Have your partner lie prone with the arm at the side, keeping elbows extended and not rotating or abducting the upper extremity. The axis of rotation is the greater tubercle. The stationary arm is parallel to the thorax and the mobile arm is down the midline of the humerus. His measurement is 62 degrees. The normal range of motion for shoulder extension is 60 degrees. Have your partner sit at the edge of the mat table with knees bent and dangling off the side. Have them move their heel medially as far as they can to measure hip external rotation. The axis of rotation is the anterior patella. The stationary arm is perpendicular to the floor and the mobile arm is aligned with the anterior crest of the tibia. His measurement is 45 degrees, which is the normal range of motion for hip external rotation. Have your partner sit with head in neutral position. The axis of rotation is over the center of the skull. The stationary arm is parallel to the acromion and the mobile arm is the tip of the nose. His measurements for cervical rotation is 85 degrees. Normal range of motion is 80. To test the upper fibers of the trapezius, have your partner sit at the edge of the mat table with arms at sides. Stand behind him with both hands on the tops of his shoulders. Have him shrug his shoulders and resist in a downward direction. He received a grade of 5. The origin of the upper fibers of the traps are the external occipital protuberance, occipital bone, ligamentum nuchae, and the spinous processes of C1 to C7 vertebrae. It inserts on the clavicle, acromion, and scapular spine. The actions of the upper traps are scapular elevation and upward rotation, lateral flexion, and contralateral rotation of the neck. These motions occur in the sagittal and transverse planes. To test the gastrocnemius, have your partner stand with knees straight and have them lift their heels off the ground going through full plantar flexion. Count how many consecutive heel raises they can do to grade them. A grade of 5 is 25 or more, while a grade of 4 is 10 to 20, and a 3 is 1 to 9. He did 25 consecutive heel raises, so he receives a grade of 5. The gastroc originates at the femoral condyles and inserts at the calcaneus. It does knee flexion and ankle plantar flexion, which occur in the sagittal plane. To test the quadratus lumborum, have your partner lie supine, holding the edges of the mat table. With both hands, grasp one leg just proximal to the ankle joint, and have your partner hike his pelvis towards his ribs and pull down on his leg. He receives a grade of 5. The origin of the QL is the iliolumbar ligaments and the ilia crest. It inserts at the 12th rib and the transverse processes of L1 to L4. It does motions in the sagittal and frontal planes, including lateral flexion of the spine, elevation of the pelvis, and depression of the 12th rib during respiration.